Hello everyone. Welcome to the fascinating world of hematology. What is hematology? This is the study of blood, blood forming organs, blood disorders, and also with others complex system that sustains life through oxygen transport, immune defense, and manifesting homeostasis throughout the body. Now if we see about the contents, what is hematology? Blood components and main functions, and then some case studies also, and what are the advancement is going on hematology and some key takeaways. So if we think, what is hematology? Hematology is the specialized clinical science focused on blood, and not only blood, also with bone marrow, lymph nodes, spleen, etc. And it encompasses both laboratory science and clinical medicine, investigating the composition, function, and disease of blood. So, if we see what are the main functions of blood, everybody we know that the main functions of blood are transport, waste removal, regulation, and defense. Transport, we know that it delivers oxygen, and it also with oxygen it carries the nutrients and transport in different types of cells in the body. And waste removal, we know that it collects the carbon dioxide and take away from the blood, from the body also. And it regulates the body temperature and provides the immune protection against pathogen through white blood cells and antibodies. Blood components overview means if we see the composition of blood, then we can see that blood consists of two major components, main components. So 55% plasma and 45% formed elements. So now we focus on plasma, that is the liquid matrix. Okay, so here we can see that 90 to 92% are water, means majority are water. Then 7 to 8% are proteins, and 1 to 2% are other substances like nutrients, hormones, dissolved gases, waste products, and 1% are electrolytes like sodium, potassium, calcium, magnesium. Now, red blood cells means RBC. So, its another name is erythrocytes, are the most numerous cells in blood, and it's approximately 5 million cells per microliter, and it contains hemoglobin, we know that thing, and iron rich protein that binds with oxygen, that is and it is means if you see the shape, then biconcave shape that maximize the surface area for gas exchange, because previously I told that it carries the oxygen and it take out the carbon dioxide also. Now, white blood cells or WBC. If we see here, that is granulocytes, and then granulocytes means granules are present, that is neutrophils, eosinophils, and basophils, and then lymphocytes, that is T cells and B cells. We are telling that T lymphocytes and B lymphocytes, and then are monocytes, that is largest white blood cells. Okay. Now coming to the platelets, its another name is thrombocytes, and platelets are the clotting specialist, means it helps in the clotting procedure. Without platelet, clotting cannot be happen. Here you can see this, that how this happen. Okay, and it is basically small and irregularly shaped cell, and fragments derived from megakaryocytes in the bone marrow. Next, hematopoiesis. So, hematopoiesis means blood cell formation. Just we are talking about the different types of blood cells, but how it forms. So, first is the hematopoietic stem cells, that is multipotent cells residing bone marrow with self-renewal capacity and potential to differentiate into all blood cells types. Now the progenitor cells, and this basically the cells just before the mature cells, and they basically decide which type of cell will mature and what type of cell they will give, and ultimate is the mature blood cells. Now the lineages in hematopoiesis. First is hematopoietic stem cells. Second is progenitors, that is myeloid and lymphoid. Third is precursors, committed cell lines. And fourth one is the mature cells, that is functional blood cells. Now regulation of hematopoiesis, that is means which thing or which substance or who basically regulates the hematopoiesis. Okay, first one is erythropoietin, that is produced from the kidney and in response to low oxygen, and stimulate the red blood cell production in bone marrow. And as the red blood cell production will increase, then also definitely oxygen carrying capacity will also increase. Next is thrombopoietin. It basically regulates the platelet production by stimulating megakaryocytes. So definitely it will help in the blood clotting procedure. And third one is the colony stimulating factors, that is GCSF or GMCSF, and other stimulate production and differentiation of various white blood cell types during infections or inflammations. Means if any infection occurs, then which type of white blood cell will go there and do the function or do the fight and prevent our body, that is decided by this. Now the blood cell maturation, because if only form and then no maturation occur, then other basically no function will occur. Okay, so if we see here blood cell maturation from blast to function, blood cell undergo a series of maturation stages before entering the circulation. First one is blast, the earliest recognizable precursors with large nuclei and minimal specialized features. And then intermediate forms means progressively acquire lineage specific characteristics. And then the mature cells means fully functional cells. Okay, here you can see that these red color, these are the mature RBC. Okay, and these blue color are WBC. Okay, now the complete blood count. We hear about this because if we visit to any doctor, they are giving the CBC. Okay, so this is CBC is nothing, just complete blood count. RBC count, that is 4.5 to 5.5 million cells per microliter, and WBC count is 5 to 10,000 cells per microliter. Platelet count is 150 to 450 thousands per microliter, and hemoglobin 12 to 16 grams per deciliter. Definitely hemoglobin varies in case of male and female. Next is hematocrit, that is 37 to 47 percentage of blood volume. Now the key red cell indices. So here we see that red cell indices provide important information about the size and hemoglobin content of red blood cells, helping to classify anemias. Means through this we can understand that what type of anemia means what is the about the size. If the size is small, then definitely it can carry less amount of hemoglobin. So first is MCV, that is mean cell volume, average size of blood cells 80 to 100 femtoliter, and it is used to classify anemias as microcytic, normocytic, or macrocytic anemia. Then mean cell hemoglobin, that is MCH. Here average amount of hemoglobin per red cell 27 to 33 picogram. And then last one is mean cell hemoglobin concentration, that is MCHC, average concentration of hemoglobin in a given volume of red cells, that is 32 to 36%. Now the common hematological disorders, anemia were very, means it is very well known and we know everyone regarding this. When we go test for the hemoglobin, and if we see that hemoglobin is less, means below the normal value, then we can tell, or we understand also, and the doctor tell that is the anemia. And reduced red cell mass or hemoglobin content, and resulting in decreased oxygen delivery to tissue. And common types of anemias are iron deficiency, B12 and B12 deficiency, and hemolytic anemia. These are the cell morphology. Okay. Next, leukemia. Leukemia is the malignant proliferation of white blood cells. Okay, means it is increases the number, interfering with normal blood cell production. And then is thrombocytopenia, abnormally low platelet count, means platelet count is below the normal. And you know that thing that it occurs normally, platelet count reduce in the dengue fever, and it goes basically below 20,000. Okay. Now some we are talking about what is blood, what is hematology, what are the functions and different tests. So now what are the diagnostic tools in hematology? If we go for the CBC, then blood films needed, then bone marrow biopsy sometimes also needed, flow cytometry, molecular testing, and coagulation studies. Now the role of hematologists. Basically, who are taking the blood for your blood test, they are known as phlebotomists. Okay. And the role of hematologists are diagnosing blood disorders. They interpret the complex diagnostic test to identify conditions. Okay. Next is the managing treatment plans, which plan they will give for the person specific. Means if you have also anemia and I have also anemia, and the both treatment cannot be same or can be same. Okay. Next one is performing specialized procedures. Definitely sometimes they can be given for conduction of bone marrow biopsies, some chemotherapy in case of definitely cancer, you understand that. And next one is monitoring long-term outcomes, what they are giving, and what are the output basically they are getting. Okay. Now the advancement in hematology. So now we know that thing that in like every cases, hematology also doesn't mean that the very old procedure, only the blood test they are giving and doctors are giving some medicines, not like that. Now the medical science has improved a lot, and we can understand, or we know that thing also, that here some patients are admitting and from some other places the doctors are operating. So it's also an advancement. The same thing happens here also, that targeted therapies, drugs designed to attack specific molecular abnormalities in cancer cells, means it maybe it is helping in future, and that is basically, here we know that thing in cancer, all cells, means the attacking cells which are basically not attacking, the affected cells and other cells are also destroyed. But here, through these target therapies, only the abnormalities and the specific molecular abnormalities in cancer cells can be treated. Next is gene editing and CRISPR technology, offering potential cures for genetic blood disorders like sickle cell diseases. And we know that gene editing is a very, means very costly, okay, but still, as the research going on, that we can think that in future, definitely, we can also afford this thing. Next, CAR T cell therapy, that is engineering a patient's own immune cells to recognize and destroy the cancer cells. As early also I told that immunity varies different person to person. So how your immunity is going on, that depends upon you, and how my immunity is going on depends upon me, means my body. Okay. Next is artificial intelligence. You are very well known regarding this, that is AI. Okay. So that is machine learning algorithms and improving diagnostic accuracy and predicting treatment outcomes. Okay. And AI, you know that thing, everyone is using the chat GPT. Now we just see a case study. Okay. So if you see that a 145-year-old female present with progressive fatigue, shortness of breath, and pale complexion for 3 months, okay, and reports that heavy menstrual periods is going on. Then laboratory findings, definitely CBC shows hemoglobin 9.2 gram per deciliter, which is definitely low, you understand, and MCV 72 FL, and that is ferritin 8 milligram per, um, sorry, milligram not, this is nanogram per milliliter, it is very low. Okay. Then diagnosis, definitely iron deficiency anemia secondary to menorrhagia, means heavy menstrual bleeding. Now the treatment and outcome, oral iron supplementation is needed. Now some key takeaways, the essence of hematology, means we can say that the nutshell. Okay. So blood is very complex tissue essential for oxygen transport, immune defense, homeostasis maintenance, and field of hematology integrates clinical medicine with laboratory science to diagnose and treat blood disorders. And understanding the normal blood cell production and function, means you have to understand the normal value and what are the functions are going on. Then you can understand that when you get the another value, then you can identify that what's the going on. And next is advance in molecular diagnostic and targeted therapies, transforming treatment approaches and patient outcomes. And it intersects with virtually every medical specialty from cardiology to oncology. So now, means the, now we can come out from the world of hematology, and I have written some book also regarding that, that handbook of hematology, and this paperback book is available on Amazon. And then concise hematology, it is in concise form. Basically we prefer this thing basically always. And it also includes important topics of hematology, and you also get this book from Amazon. And now the hematology in question and answer form. Okay, some MCQ and some long question, short questions, this thing. You also get this from Amazon. And hematology short questions and answers. Uh, you will get this both ebook and paperback form. Now, definitely like, share, and subscribe to eduhub.2m channel. Okay. Thank you.